Welcome to the Dogtor Bros, where we have an honest discussion about vet life in and out of the clinic. My name is Brandon, and I'm your doctor of the day. I'll be your guide through this episode. I'm a small animal internal medicine focused veterinarian living in Fort Collins, Colorado, and I'm here with my closest friends from vet school.
Hey there, this is Jeff. I'm a dermatology associate veterinarian out of Louisville, Kentucky.
Hey, this is Adam. I'm a relief veterinarian in Louisville, Kentucky as well.
Hey, this is Chris. I'm a GP in Winston-Salem, North Carolina.
And today we'll be kind of doing a clinical focused episode. We all work in different areas of the field, in particular small animal, but we all do a lot of diagnostics. And whether you're seeing your general practitioner, whether you are a general practitioner, or if you're someone in the specialty field, there are a lot of different diagnostics out there. Sometimes things are, so common we don't even think about it. Sometimes there are some common things that are underutilized, and we're just going to have a general discussion about it. So before we get into that, just do a little opening game with the guys here. If you had the option to be adopted by two celebrities, who would you pick and why?
This is Jeff. Even though I wrote this question, it still took me a minute because there's so many fantastic options. So I'm just going to go with my knee jerks, which would be Gabrielle Union, because she looks amazing, doesn't age. Like, I can't. No notes. If you haven't seen Bring It On, watch Bring It On. And then Dad would most definitely be Pedro Pascal, because I don't know what to tell you guys. He's daddy.
I'm shocked you didn't say Beyonce. I'm just throwing that out there.
Oh my God. I really, really, it was on the list. I'm having a moment. Move on.
This is Adam. I kind of have two, and they're both actually couples. So I would say either Ryan Reynolds and Blake Lively, or Dax Shepard and Kristen Bell. I feel like either one of those, there's never going to be a dull moment. Both of those seem like pretty awesome celebrity power couples, and I just feel like it would also always be a fun time with any of them.
This is Chris. I do like those. Adam, Ryan Reynolds and Blake Lively were definitely an option. But I'm going with a new couple. I'm going to go with T Swift and Travis Kelce.
I can't breathe. Immediate roast.
It just seems fun right now. So, plus, I can go watch football all the time, get more VIP access with it. So, I mean, I think that's a win.
You'll definitely be well off.
I mean, that too. It's okay. I'm more for the football.
I mean, this is Brandon. I was definitely going to pick Taylor Swift.
Okay.
For sure.
Thank you.
Like, well off. I'm a fan of the music. I don't really care what anyone else says. If
she has some good music.
She's got good songs.
Yeah, music's all right.
Great music.
We're not haters.
What is wrong with you? Anyway. Yeah. Taylor Swift.
Not Brandon the Swiftie.
I am. It is what it is.
Brandon, it's okay.
I'm not sad about it.
Our house is all Swifties. I mean, I think Natalie's a converted Chiefs fan now, so it's been a debate in the house.
Yeah.
I'm an ally.
I guess for I probably wouldn't go like Swift Kelsey. I'd go Swift and then I'd go Post Malone.
Posty.
Yeah.
Interesting.
Yeah. He actually just came out with this double album that's all country, and it is
this country album.
Fantastic. So yeah, big into the music. And then, yeah, money is no problem. I'll never have money problems again.
Can I just say, I'm just concerned that he doesn't look like he does. I think Mr. Malone has an amazing voice, but it doesn't always look like he puts hygiene as like number one on his list. I'm just going to say looks like. Might be wrong. Could be completely dead wrong. If you're a big Posty fan, I'm so sorry. I do like him. I have concerns.
Yeah. I didn't pick them for the hygiene. Just to be fair.
Maybe it's just me.
Anyway, well, no, that was good. That was interesting. How about we get into the topic today? So there's a lot of diagnostics that we do as veterinarians. There's kind of our bread and butter stuff, basic blood work, which I have a lot of opinions on and we'll talk about. And then there's some really niche things, like for Jeff, being in the dermatology world, there's some derm diagnostics that I will never do myself and I'll always refer.
Not with that attitude.
I will not be doing. I don't think I'll be doing skin biopsies. I could eat those words down the road, but I don't foresee myself doing skin biopsies. Anyway, we'll see. Never say never. So, just for the group, if you kind of thought about some diagnostics, whether they be super simple or maybe something more niche, what do you think is underrated?
This is Adam, and I guess I'm trying to get some brownie points with Jeff on this one. But I would say, and maybe I'm biased because I hear so many horror stories from him and being in the same town. I'm terrified I'm going to do this. But skin scrape is a big one, because you see these dogs come in with, skin that just looks atrocious, and you're thinking bacterial infection, fungal infection, allergies, those sorts of things. But it's really easy to overlook and not think about something like Demodex or Sarcoptes, something along those lines. And I know Jeff has told us horror stories of him getting cases referred to him where the referring vet has done a bunch of different things. He does a skin scrape and there's Demodex everywhere, and all they needed was a Provecto. Again, I'm terrified that that's going to happen to me living in the same city as Jeff. So I do feel like that is extremely underrated because, again, that escapes my mind sometimes too. So I think that's a quick and easy thing just because it's such an easy fix these days. So it's something that I feel like sometimes flies under the radar.
And this is Jeff. Obviously, I am obligated to comment on that one. So yes, don't forget your skin scrapes. Depending on where you trained, it's a part of a quote unquote dermatologic minimum database. But if I'm also team, if it fits the case, you should do the diagnostic. And with the wave of isoxazolines, which treat most types of mites, we don't see a whole heck of a lot of them. But if you miss it and it gets referred to me, I'm gonna try to catch it. And I'm not gonna say nothing. I'm gonna giggle to myself a little bit in the back. But your client will never know the difference except, yes, I did a skin scrape. I found the scabies or the Demodex, and here's your treatment, which is probably going to be Provecto, NexGard, Credelio, any of those. So don't forget it. And also, quick note on that, there are dogs who come in that look extremely bloody and crusted all over, and they can still be Demodex or scabies.
This is Chris. I mean, I would say I agree with Adam and then JT skin cytologies. I'd say the other thing too is blood smears. Personally don't do those enough, but I think those are underrated as a test that we should do more as GPs, or at least in our practice.
Yeah, this is Brandon. I like that you brought that up. Blood smears are great, especially if you're getting some like in-house blood work back that just doesn't make sense. It's a simple way to kind of just double check things, do a manual count. If you're a veterinarian listening to this, like it's very underrated. I have seen, unfortunately, a couple of clients referred. The pets ended up being fine, but they were referred for like really bad stuff, like severe blood loss or extremely low platelets, for like suspected immune-mediated disease. And then we ran our own blood work, and where I used to work for residency at Iowa State, they always did a blood smear with the blood work, and it was normal, unlike those like two individual cases. And these clients had driven like a couple of hours, and it was a waste of everyone's time and money. And simple thing to do would have been to do a blood smear, and we would have avoided all that. Or you could have confirmed those cases where it actually is happening. You're like, oh crap, you need to go to the ER now. So yeah, I totally agree. Even on a more simple note, basic complete blood count, serum chemistry, and urinalysis, especially urinalysis along with those things, sometimes that just kind of gets forgotten about. We just do the CBC and the chemistry. For any clients out there, that's kind of the basic blood work that most of your GPs are recommending when an animal is sick or for just wellness purposes. And I can say it's a very, very undervalued thing. When a pet gets older and we have some up and coming diseases, I love to refer back to blood work that's a year, 2 years, 5 years old, just to be like, okay, this was normal back then. How does this coincide with the changes that the owner's seeing at home? It's just very underrated. As an internist, we get some records from older pets that are sometimes extremely short, and that's disappointing. And I don't love reading through 100-page records, but when I find blood work from 5 years ago and a dog has some new problem and we've identified that it was normal at one point in their life, it's a huge bonus. So I cannot stress enough basic lab work, ideally once a year. If you have a senior pet, ideally, if you have the funds to do it twice a year, that'd be great. But once a year, you're going to be in really good shape and you might catch something early.
And first of all, I wanted to comment and say that is really helpful. In my world, Brandon, I do a lot of, I'm so happy if I can get a year of past records. And then beyond that, I'm like, what am I even looking at for derm world? But to be fair, most of my patients come in fairly clinically healthy with bad skin. But I also wanted to bring up my actual undergraded test that I hadn't mentioned, which question to the group, the answer might be no, but have any of you ever heard of a trichogram?
No.
Yes, I have.
Okay, I'll take one. Adam?
No.
Okay, so some people will call it a hair pluck, and it's exactly what it sounds like. You can pull hairs and put them on a glass slide, and you can use your fingers, you can use hemostats, but you take a collection of hairs. In particular, they're helpful for places where you can't scrape. So I do it around the eyeballs at affected looking skin, or sometimes on the paws, anywhere where I'm not interested in taking a 10 blade necessarily. And you can look at the hairs. So you can easily open a book or Google what a normal hair looks like. The normal medulla in the middle and the cortex, the outside. But they're very helpful for catching. You can actually catch Demodex because they live on the hair follicle. Sometimes you can catch scabies. I think it's less common, but you could potentially catch different kinds of mites. Dermatophyte, I caught one last week. So it can actually be a really quick and easy way. Potentially, I don't know if it's statistically known, but you could maybe catch more than something like using a woods lamp, because wood lamps are at best 50-50 for catching microsporum. I think usually microsporum canis, but it's just a nice, very easy test. You look at it under the microscope with the same parameters that you look at for a skin scrape, which I won't go into. That can be for a different day, but it's very easy to collect a bunch of hairs, put a little oil on them, and just look at them under 4x, 10x power. There are also some genetic conditions like color dilution alopecia, which is much more rare but more common in those dilute breeds, like quote unquote silver or gray labs. You can sometimes catch clumping of melanin, and the hair follicles actually break in those areas, and they can be extremely suspicious. And, especially in cases where you can't necessarily biopsy because it's too expensive, that's something that you can almost completely diagnose, even if you can't confirm on biopsy with a condition like that. So highly underrated and easy.
This is Brandon again. Some other simple stuff, if there's any owners, like non-veterinarians listening to this, anything that involves a mass on your pet, ideally, if you can get if your vet can get a sample of that and send it out for evaluation by a pathologist, that's the most ideal. Sometimes there's some things that look really benign and they're not. It does like there are some masses that are like, yeah, this is most likely a lipoma, but again, you don't really know for sure till you poke it and get a sample. Same thing goes for if you get a mass removed. Um, make sure that your vet is setting them off, or if you are a veterinarian, just send it off and include it in your estimate. There's nothing worse than, we had a mass removed from a dog like 2 years before, and then something's coming back, and I get referred to it because it needs imaging. And then all of a sudden we're like, what was this mass? Oh, nothing was done. We don't know what it was. Is this the same thing or is this something new? Can be very frustrating. And then just one more thing for me, and you guys can tell me your thoughts on these three. Radiologist interpretation of x-rays or radiographs. I think that's pretty undervalued. It's one thing to look at an x-ray. I myself where I have to like look at my own x-rays from patients and make some decisions on the spot. I almost always, I always would get a radiologist opinion on them, unless it was something taken at a vet that it's like old records that I'm like reviewing myself. And even then, if there's a radiologist on staff, like back when I was at Iowa State, I would just grab their opinion if they were available. It goes a long way. The radiologist did extra training just like Jeff and I did for our individual specialties, and they have some nuggets for little things that maybe we would overlook. So I highly recommend getting that done if your pet needs imaging.
I ain't looked at a radiograph in a long time, so I can guarantee if I'm looking at a rat, it has probably gone to somebody else. It's gone out somewhere. I don't have any business looking at radiographs anymore to diagnose things, but I'm in derm land.
There's no skin x-rays?
No.
I wish we did send out more x-rays to radio. I mean, we'll send them out if we can't figure out a case, but a lot of times, I mean, it's just, some of it just boils down to being like cost prohibitive. Like, okay, it's radiologist, or we can go, hey, we can do some blood work now instead of doing, like, it's just, there's so many, cost does play a factor, at least for us. And I wish I'd send everything to a radiologist because it'd make me feel a lot more comfortable, but sometimes it is what it is, and you can only do, I mean, even like the biopsies, like sending those off. When I first started where I'm at, it was a lot harder to get clients to like do the histopath. Like, please just do it. And they're like, no, we're not doing it. It's like, I have no clue what we're treating, so what we're taking off, but okay, we'll take it off. And even now, some clients still do that, which is fine. It is expensive to send it off, but at least more and more we're coming like, okay, we're taking off and we know what we're dealing with. We can at least plan for the future. And if it comes back as like a benign, like a lipoma or something, like, that's fantastic news. Like, it's not bad news to get that back. Like, you don't wish it's something bad, but it does make it so much easier to like explain what can happen next. And like, yeah, you should probably go see the oncologist now because this is a cancer that we need to get dealt with, or something along those lines. But yeah, I wish more clients would do it, but I'm glad more are still doing it now. Like, the longer we've been in practice where I'm at, like, I would say the majority of them send them off now, which is pretty awesome.
I like that you brought that up. There's two things there that I think are important. Like, cost is always going to play a factor no matter what we're doing. Even on my end, people, for the most part, are prepared like that they're going to be spending more money when they see an internist because they've already done some basic stuff and they know they're going to need to do more diagnostics. But cost is always a factor. And, we have to just do the best we can with the knowledge that we have. And that's why I think it's important to talk about some of these tests that can be done, on your guys' end as GPs, because they can go a long way. One thought on the histopath, like, yeah, if you could only afford to remove the mass, like, so be it. I think it would be cool if you're able to swing it, like, just do a quick cytology of whatever you get, like, just cuddle a piece, put it on a slide, make a smear. And if, things look really funky, obviously if you see like a bunch of fat cells and you remove this giant mass and it looks like lipoma, it's flopping like a lipoma, it's probably a lipoma. But it can go a long way to just do something really quick in-house. Be like, you know what, like, I saw this on the slide. It's really concerning. Hopefully, like, please let us send this off. And, that might sway some people that are, maybe able to do it, but just don't want to spend the extra money when at the end of the day, it could like save them money down the road.
That's facts. Yeah, I wish it's hard. I mean, and even then, like cytology is not
Hashtag of the day. Oh my! You're gonna hear that. Let me write that down. That's facts. We got our Gen Z friend Chris on the pod.
You're welcome.
I don't think those words have never come out of your mouth before, and I've known you for like a solid decade.
I must be hanging out with her text for too much.
Thank you so much. Oh my god.
The thing is, like cytology, sending those like or reading them, I can be like, that looks terrible, or it's a lipoma. Like I can probably diagnose two things, and it's lipomas and a super obvious mast cell. So, but yeah, other than that, I just say like, it's bad, send it off, or I don't know what it is, send it off. So that's kind of where I'm at with it.
I mean, I'm not the best at cytology either. And I always refer to, like, I always want to get a pathologist to read it out. But I'm not afraid to, like, one thing residency taught me is, like, don't be afraid to just look stuff up. And even if I look it up, maybe I still don't know. But, like, I got myself a little, like, tableside cytology book. And if it's, like, a spleen aspirate, if we're doing an ultrasound or whatever on my end, and something looks funky, I will take a look at that slide. I will flip through some of the images if I'm not sure and see if I can get a sense. But anyway, I think it's hard, especially on your guys' end. You know, I remember, we all remember what it's like to be a GP. Jeff and I, we were both GPs for a time, and sometimes you get clients and they can only do so much. And, you know, that it's on you, it's on us to make the best decision in the moment for, you know, what our capabilities are between the client and ourselves. Another thing I wanted to bring up are just some uncommon tests that any GP can do. I think that these are super valuable because sometimes what'll happen is, here's an example. You know, we have like an older dog. Someone has the capability to do like a little scan of their abdomen to get some urine. They see some sort of like big mass in the bladder, and it's concerning. And maybe that's something that's benign. Maybe that's something that's serious. One test that is extremely easy to do. It's not cheap, I'll give you that, but it's easy to do. Is called a CADET BRAF. And basically it's provided by Antech. They send you a cup with some reagent in there. You collect I think it's 40 mils of urine, if I remember correctly. And then you just ship it off to them. And then there's like a 95% positive versus negative like correlation. If it's positive, 95% chance that this is some sort of urothelial carcinoma or transitional cell carcinoma. And if it's negative, then you can effectively rule that out. Can't do it in cats. It's a dog test, but it's very useful because instead of getting referred to me and doing imaging and then trying to figure it out, you could skip that step and then send them straight to an oncologist if that's what it is, if they want to move forward. So, you know, that's just one. Is there anything that you guys can think of that maybe you don't do often, but, you know, it could save the client a little bit of time?
This is Adam. And I actually, I've done this a couple times, and I actually wanted to get the internist's opinion on this because I have read a lot of pros and cons on this specific test. But when it comes to diagnosing FIP in cats, I know it can be kind of difficult. And a quick little in-house test that I can run as a GP is the Revolta test. I've done it a handful of times, and I've had fairly well success with it. You know, when it's positive, it was positive. When it was negative, it was negative. And with that, typically what I've used is sterile water, and then you're supposed to use nearly 100% acetic acid. I've used just basic vinegar, which is actually only like 5% acetic acid. And it's tended to work well with that. I don't know if that's just me being biased or I got lucky or I'm being dumb or what. But again, that's why I kind of want to get the internist opinion on that, just because, again, I don't really know a lot of great options when it comes to testing for FIP. So if there's something better out there, again, that just has been kind of a quick and easy and cheap way to kind of get an idea. So I was just kind of interested in your opinion on that and potential alternatives.
Yeah, this is Brandon. It's not a useless test, but it's not like an end all be all. So like a lot of it comes down to the viscosity of the abdominal fluid that you pull off. And like if certain things line up, like there's actually some stuff that I would look at on a like a complete blood count and a serum chemistry that would give me some pause. Before, I mean, obviously, yeah, the Revolta test, if there's abdominal effusion, I like that you're sampling it. That can be useful. It can be suggestive, but it's not like a definitive diagnosis. And if a client just can't afford to do some stuff and they're able to like trial treat with the medication and it seems like FIP is a high probability, I think it's reasonable to refer them to like start treatment, just understanding that, if we didn't do all the other things to rule out other possible causes of what's going on, and it might not work and it can be expensive. A lot of things have changed actually recently with FIP, feline infectious peritonitis, for anyone that's not familiar with the terminology. And some of the drugs that were not as readily available are now available and can be prescribed. So, that's a pro. But yeah, the Revolta test in itself is not great. I think the best test you can do would be some sort of histopath. But usually, unfortunately, that's like a postmortem test. There are some specific like antibody type markers or markers that you can do to look for coronavirus in some like cytology samples or in like a needle aspirate of a tissue that looks like it's affected by FIP, because there are some dry forms of FIP where they have FIP, but they don't have effusion. So that can be really difficult to diagnose. But I would kind of refer back to the basics. Like, is their globulin count really high? Sometimes those cats are anemic. The age distribution, like if it's a middle-aged cat, like between 4 and 7, it's probably unlikely. If it's 2 or younger or greater than like 8, 9 years old, then it's like in that bimodal age distribution. But yeah, just a short answer, Revolta test, it can be helpful, but it's not like an end all be all.
And I know you mentioned globulins there too. I did see some literature on a low albumin globulin ratio of like less than 0.4 being suggestive. Obviously, these aren't definitive types of diagnostics here for that. But have you seen that as well, that in more so of the FIP cats they've had low albumin globulin ratios like that?
Yeah, it's like another typical internist thing where it's like it's very helpful, but it's not always there. So when I see that and like everything else fits really well with FIP, I'm like, okay, this is FIP until proven otherwise. But if the albumin globulin ratio is normal, I'm not going to rule out FIP completely. For any like vets that are out there listening, there are some actually really good, more updated resources on like all of the things that you can do and like which ones give you the best probability. I'm kind of blanking on some of the individual tests. So I even have to refer back to my literature. But Adam, I'm happy to send you, like, I have an article in mind that has a lot of stuff that I know that you would be keen on looking at to give you kind of like exactly what you need. Most of those cats, like we're kind of ruling out all the other stuff. And then if nothing's left and we can't do certain things, we're FIP is like high on the list. So, FIP, very, very tricky to diagnose, was more difficult to treat. Now that's starting to change and cats can have a really good response. The other tricky thing for any owners out there that are listening, it's like they can present in so many different ways. So it can be very challenging. Other things that I just wanted to throw out there that are really easy. are like some infectious disease tests. So if you're in a region that has fungal disease, cough, cough, the Southeast, cough, cough. I'm out of that region now. And back in Iowa, they had a lot of fungal disease. But if you have a pet that's, if it's on your list and it's suspicious, there's really simple things you can do. The simplest thing you can do that unfortunately takes like a couple of days to get back, but you get a urine sample. I think it's like 6 mils of urine is what they need, or 5 mils. You send it off to this lab, Maravista Labs. If you're in an endemic region for histoplasma or blastomycosis, 2 major fungal agents that cause systemic disease, then there's a urine antigen test that's very specific for those and sensitive. So if that thing comes back positive, it'll say like a quantitative level of like positive or negative, tell you kind of how high it is. Sometimes it'll say too high to read. And if you're trying to save a little bit of money, the histoplasma and blasto, both of them are on your list, but you don't know which is which. They're both treated the same way, and both of them cross-react. So if a dog has blasto, but you submit the histo test, it's going to come back positive anyway, and vice versa. That might be a way to save you some money. There are some other fungal agents out there that may or may not cross-react. I just remember it wasn't my case, but there's a dog that had aspergillus that ended up being like slightly positive for one of the other fungal agents, and they started treatment for that, and it didn't quite get better. And then we did more diagnostics and found it. So long story short, very easy. Get a urine sample, send it off if fungal is in your region, like histo and blasto in particular are in your region and on your differential list. And that's a really easy way to rule things out without like sending the patient to like an internist or something, especially if they're only having mild clinical signs. Obviously, if a pet's really sick and they need to go to an ER, like ship them off.
And this is Jeff. I just want to put in a quick plug for we in Skin World see a good bit of blasto too. So don't forget about sending off those blasto urine antigen tests for really challenging, odd skin cases, especially things that are on the younger side and just have huge, often draining tracts or a lesion that is crusting and spreading. Sometimes they can be cellulitic. Sometimes they can be very edematous. And those patients usually are feeling systemically ill as well. So those are red flags for me. And I might send off a blasto too. So that's pretty commonly on my radar, at least here in Kentucky.
Yeah, hopefully you're catching it on a cytology at that point too. I've done that before.
Yeah, you can. And it's really nice when you have a draining lesion. That's a really good point, is just doing an impression smear of that fluid and staining it just like you would for a skin cytology. You can catch that broad-based budding that we learned in school. And I'd say they're pretty noticeable. And obviously anybody in here can send me a picture if you're not sure.
Just to kind of do a couple more things, then we can start wrapping up. Thinking about with what we've talked about, or something maybe we haven't touched on, is there anything that you guys feel like you should be doing more diagnostically?
This is Jeff. I'm not going to say one that I'm doing more. I'm just going to soapbox my skin cytologies because I would be remiss. If I didn't mention how important they are. So it's very easy to take a microscopic slide and rub it on a lesion for an impression smear, or you can do a tape impression. I'm more of an impression smear guy, but stain it with your diff quick and just take a look. If the skin looks abnormal, you should be taking a look, because I get a lot of patients who come into me for infections that I'm culturing, or sometimes I do an impression smear and there's not an infection and they need biopsies because they may have something autoimmune, but you don't know what you're treating for if you just throw antibiotics at something or throw antifungals at it just because you assume that it may have yeast or bacteria. So I encourage you to take a look. And also, I typically will recheck my patients, recheck cytology and see, is what I'm doing working? Is it gone? Even with ear cytologies, I'm constantly doing them to confirm what I'm looking at and see how treatment is going. Did I treat all bacteria and now there's all yeast? And now I need to switch my ear drugs. But clinically at home, they may just see head shaking in a dog that has an ear infection. And they're going to come in and say, nothing you're doing is working. And I might look under the microscope and say, actually, everything has changed. So we actually need to change our medication protocol because the infection has changed. Or further, maybe you don't see any infection. Maybe the infection is gone, but there's still a lot of inflammation because we need to treat for underlying. I'm going to pick on allergies because it's the most common, but if you're not treating the underlying causes for these infections, then maybe you're doing everything right as a clinician and you're clearing infections, but I think our owners get kind of happy or trigger happy with calling us and asking for antibiotics when things are improving, but then things are still inflamed or red, etc. But if they're not necessarily treating for underlying causes, then we get into a lot of overuse of antibiotics. And culturing is way more expensive than a skin cytology. So fully shameless plug. A skin cytology, almost every case I see, if they have lesions. So if there's a spot in the skin that looks abnormal, I'm cytologying it.
This is Brandon. Yeah, I love that. Sampling things that are abnormal, like skin for cytology, obviously. For me, even more broadly, if a lymph node feels big, don't be afraid to poke it. If there's a mass, don't be afraid to poke it. If you're worried it's a mast cell, make sure you give them some Benadryl before and then poke it. Like, there's all the things that we can do that are very simple. And, when it comes to sampling different things, like, you just have to prioritize it. Obviously, if you have like a 14-year-old lab that had a lump that as a GP, you've been seeing for 14 of its years, and that lump's been there for 6, and it hasn't changed, maybe you don't need to poke that one. Maybe you poked it 6 years ago. I don't know. But then there's this new one that looks abnormal, or there's a lymph node that now feels big, and you've known this client for a while, and you don't in your past notes you didn't have that lymph node being big. Just poke it. It might come back abnormal, and it might be something you can even diagnose then and there. I'm still gun shy, even if I've caught lymphoma before on basic lymph node cytologies, and I always still get a cytology review by a pathologist, but I'm not afraid to tell the client, I'm like, hey, this looks like this. I want to make sure. This is why I'm sending this out and spending your extra money, but this is really serious. Like my soapbox, I think, would be lymph nodes. Like, if they're abnormal, even if they're like just a little bit abnormal, don't be afraid to poke it. For example, there's some, like, cats can get some pretty nasty tumors in their nose. Sometimes that'll spread to the lymph nodes in the neck, and there's one that's pretty easy to access, like in the submandibular region. I've caught carcinomas on those before without having to do the whole rhino and CT scan and biopsies and all that stuff. Because at the end of the day, the client, like, once they found that out, they're like, well, I can't afford to do radiation or whatever it may be to treat this, and I don't feel the need to do these additional diagnostics if it's not going to change my treatment plan. That would be my soapbox, I guess. Well, I guess one more thing with diagnostics, and then we can move on to kind of a little outro question. We've kind of talked about this a little bit as part of the discussion, but do you guys feel like there's appropriate times to skip a diagnostic? And you're like, what's your opinion on that? It's very broad, and I have a couple opinions myself, but I just kind of leave that out there for the group.
I mean, this is Chris. I would say the only one that makes sense to skip like a diagnostic is if you poke a mass after you just removed it and you said it looks like lipoma or it's like lymphocytes. You're like, this just looks like a lipoma. You cut it open and it's just all fat looks inside. Yeah, I'd say skip that one. Honestly, I wish we could do more diagnostics. So there's not one that I would say like I absolutely would say just to skip it. There's some we skip more just because we're trying to prioritize like which diagnostic I'm going to pick and choose. Like, I want to pick the one that gives me the most broad answers, and then we'll try to figure it out from there. So yeah, I would say, I mean, you kind of said it earlier, skip a cytology or skip a histopath if you can kind of see on cytology. It just looks like looks like lymphocytes. Yeah. My bad. But if it just looks like that, but other than that, no, there's not one that I would say I would just automatically just skip because If I could do all the diagnostics, we could. I mean, that's what I would prefer to do, just to make our lives easier to diagnose what's going on with them. Because again, our patients can't talk to us and tell us what's exactly wrong, so we kind of have to piece it together and figure it out.
This is Adam. Yeah, I'm with Chris. Like, obviously, I'd prefer to do the diagnostics. When it really comes down to skipping diagnostics, the biggest time that comes into play for me is when it's cost prohibitive, or if the owner just isn't willing to have diagnostics performed. Some clients just don't want to go that route, or they just want supportive care, or whatever it may be. And, in my mind, yes, I would love to do the diagnostics. I'd love to know specifically what's going on and specifically what we're treating. But at the end of the day, like, I'd rather give your pet some supportive care than let them walk out of the door with nothing on board. So that's the biggest thing, and probably the most common thing I see when it comes to skipping diagnostics is just kind of that reluctancy from the owner, whatever the case may be, for them wanting to do that. But again, I'd rather have that supportive care on board than not.
And this is Jeff, and I'll say I wrote down a couple because it's very situation dependent for all of these. And it does come down to money, right? Because our owners have to pay for our services for the most part up front, unless they have care credit. But one that you can probably skip if you're trying to do gold standard medicine and you're worried about ringworm, you can probably skip a woods lamp, because at best, maybe you get a 50-50 out of hairs lighting up, because some people sometimes get confused with skin crusting and scale. That's not important to light up. But if you're taking the time, if you're actively charging for that service, which technically we should be, I would just go for the full DTM culture. And I usually send out a PCR with the hairs with mine too. But the culture, if I had only one and I'm looking for a ringworm, I would send out hairs for culture. Some people will, unfortunately, skip skin scrape. I'm going to catch it if you skip it. But I do think in a realistic scenario, because there are clients of mine that will decline a skin scrape and also cover them with an isoxazoline, because I'm going to be treating for a flea and tick preventative. But also if I have a scabies case, as an example, or scabies suspect, and that dog is tearing itself to pieces, itching and scratching in the room, that's usually that level of itching where they cannot be distracted is commonly reported with something like scabies. So it's okay to treat with them. Better to get a diagnostic answer, of course, but that's a scenario where if they decline a skin scrape, it's much lower priority. I'm still going to mention it to the owner, but I'm not going to shake them down, if you will, or press it really hard. I'm like, okay, we're going to treat for this, and then I'm going to prioritize like my skin cytology. Let's see if there's infection. I can also plug, let's say, because you're going to do your skin cytologies, you do your skin cytologies, but if I have a case that is, they go for the skin cytology on day one, it's infected, they come back, and let's say they have no money and they're not down for any diagnostics, instead of repeating antibiotics, if I caught a bacterial infection or antifungals, if I can't see it, I can't diagnose anything, I might go with aggressive topical therapy. And instead of reaching for another antibiotic that potentially I'm going to turn into some extra resistance, it's better to assume that you already have a resistant infection and you can treat with a 3 to 4% chlorhexidine shampoo and or mousse extremely frequently. You can bathe some dogs daily, and cats. If the owners are down, you can do mousses and treat for suspected resistant infection, even if you can't, even if the owner is not interested in paying for another skin cytology and culture. Instead of reaching for orals, I'll go really, really heavy on my topical therapies. But those are just some thoughts that I have for quote unquote skipping.
Yeah, this is Brandon again. I like what you guys said. And I think it really boils down to less skipping diagnostics. At the end of the day, like, you guys are going to recommend certain things, and it's up to the owner to make a decision, and you just have to inform them the best you can. And that's the best we can do in some cases, and it doesn't work out the way we like. I think my big thing is skipping diagnostics that should be done first that can save money down the road. So really simple example is forgetting to do a diet trial for a dog with chronic GI disease.
Or skin itch.
That's right. Very easy to do. Easier for me on the GI side because you only need about 2 weeks for a dog, maybe 3, instead of an eternity for derm. But it's really easy to do. Jeff's choking on his drink over there.
That's facts.
Nailed it.
Oh, Jesus.
But yeah, like if you skip that diagnostic, if you skip a diet trial, a medication trial, whether it be food or something else, is a diagnostic. That might be the diagnostic that you skip that made the client spend another $2,000 that they didn't need to spend. So yeah, there's things like that. There's things like, maybe a dog, this is a really extreme example, but a dog's super pale, but you never do a CBC. Like, don't skip these simple things. Trust your physical exam, trust your knowledge base. If you're a veterinarian out there and you feel like maybe you missed something, I've missed things before. You're not a bad vet, just learn from it and move on. And just, keep doing the best you can with the diagnostics that you have available. And if you're afraid that you're missing something, don't be afraid to refer it. I think that's just something that everyone needs to keep in mind. And if you're a client, listen to your vet. They're recommending things that, are going to give them the best chance to get to the bottom of what the problem is.
Yeah, I just wanted to add, since you mentioned the diet trials, that you can skip food allergy testing. It's right now, a lot of it's really not helpful. A lot of it's garbage, honestly, even though there's a lot of testing available. So do the diet trial, even though it takes longer, but it is going to save them money, because I get a lot of clients who come in and the correct next step for them is to do a diet trial. And they come in kind of gung-ho for allergy testing, and then they get sad, honestly, when I tell them that food allergy testing really is not a good idea. I'm not going to spend their money on that. But for environmental allergy testing, that may be a consideration, but often if diet is on the list, there's only one way to rule it out.
Yeah. I like that you said that. Some people will come to us and they're like, I'm ready to do the GI biopsies, put my pet under anesthesia, go put a scope down their whole body and get samples. And I'm like, well, how about we just do this first? And 2/3 of the time, that's all I need to do. That's literature. That's been my experience. So yeah. And that's something that any GP can do. They just need to choose the right diet. And there's a lot of options out there on the prescription side that are available. All right. Well, I could keep talking about that. I didn't even bring up GI panels. I'll spare you guys. But going out, what talk about what's something that you've done recently that's just fun. For me, I'll just start. I'm back in Colorado. I'm loving it. I've been doing some hiking recently. We went up to a couple places locally and then one down in Boulder. Got some pretty amazing views, and hope you guys come out to enjoy that soon. But what about you guys?
This is Adam. So recently it was mine and Allison's 8th wedding anniversary. Yeah. Woo! So took the kids to the grandparents' house and then had a nice little date weekend. We went to a nice little bourbon bar, had a couple of cocktails, just kind of chatted. And then we, the following night, went out to a nice restaurant downtown, got all dressed up and all fancied up and got a nice steak dinner together. And it was really nice. So, you have kids and you're busy with work and that stuff kind of gets pushed to the back burner. So it's nice to have those date nights every once in a while and kind of get fancied up and go out with a hot date.
No, I'm trying to catch some easy points on the pod. This is Jeff, and I'll say, number one, I remember when Allison wasn't even on your when she first got on your radar, because I felt like you probably started dating her pretty early in the first year of vet school. But I remember when we were chatting as buddies, just do we think this is going to be a thing, or kind of like, or let's see how this date goes. You want like a date to church or something? And I was like, oh, okay. It clearly worked out.
He hates it when I say that, but our first date in church.
The Lord. I mean, what else? Amen. And my recent fun thing is extremely simple. My buddy Steven came over yesterday, and we hadn't caught up in months, and I made margaritas, and we just chilled on the couch and caught up on each other's lives and played a small amount of video games. Sorry, I didn't invite you, Adam.
I forgive you.
It's a load off my chest.
This is Chris. Recently, we just went to the beach as a family a couple times now. So we went earlier this summer and then again just recently. So that's been fun. Yeah, I mean, it's been a busy summer. We've just been traveling randomly when we can with the kids and try to do something fun in general. And then before the summer started, Natalie and I had some date nights. So we went and saw some comedians. So we're trying to pick that again up probably here soon. So that's it. I mean, nothing crazy going on, just hanging out, having fun, and doing stuff with the kids. And then just still trying to, like Adam said, make time for each other and just doing our own thing. And it's been definitely more hectic the last couple of weeks, but it comes in waves. We'll probably do something where it's just us two probably here in the next few weeks.
Awesome. Yeah, I think the simple things are overrated. Like just hanging out at home and spending time with friends. You know, I'm looking forward to hopefully seeing you guys in Louisville. Maybe we can convince Chris to come get some internal med seat.
Woo!
And we can
through.
all be there at the same time. So yeah. Well, thanks for sharing everything, and I think we had a good discussion. And if you enjoyed this, be sure to share. And thanks, everyone.
Thank you once again for joining us on the Dogtor Bros.
If you would like to support us, please share this episode with others who may be interested in today's topic, and leave us a 5-star review on Apple Podcasts, Spotify, or wherever you listen to your podcasts.
Would you like to influence our next episode? We love hearing your opinions and thoughts. Your comments may be our next topic.
Please leave us suggestions via email at thedoctorbros@gmail.com, DM us at thedoctorbros on Instagram, or leave us comments on our posts. Again, this is Brandon. You can reach me at Dr. Mason IM on Instagram.
And this is Chris, and you can reach me on Instagram at dr.chrishernandez.
And this is Jeff. You can find me on TikTok or Instagram at DermDrJeff, DermDogtorJeff.
And this is Adam. You can reach me on Instagram at DrAdamDVM. That's DrAdamDVM.